In Connecticut, there are 2 Level 1 trauma centers that train for mass casualty events. NBC Connecticut's Justin Shecker continues our team coverage live from Yale New Haven Hospital. Justin?
Well, Kevin, good afternoon. As a Level 1 trauma center, Yale New Haven Hospital has a team of surgeons ready to mobilize in the event of a mass casualty incident. And the head of the trauma center here is friends with a doctor who has that same role in Las Vegas. At Yale New Haven Hospital,
there are a significant number of physicians that can go ahead and take care of a mass casualty event.
Dr. Kimberly Davis is the chief of general surgery, trauma, and surgical critical care.
We have 11 fully trained trauma and emergency general surgeons.
But when the Yale New Haven emergency room expects an influx of patients, other surgeons are prepared to help. The same is true at Connecticut's other Level 1 trauma center at Hartford Hospital.
That includes neurosurgery and orthopedics, plastic surgery, and even, you can imagine, surgical oncology and transplant surgery would be beneficial because they have expertise in dealing with different organs.
Dr. Davis says the Yale New Haven Trauma Center would set up 2 triage areas, one for the walking wounded and the other for critically injured victims.
And a determination would be made who is likely to survive, who would best benefit from early aggressive intervention.
When Dr. Davis first learned of the deadliest mass shooting in U.S. history, she thought of her friend who runs the Level 1 Trauma Center at the Las Vegas University Medical Center.
The trauma surgery community is a small, tight community, so I knew all of the surgeons who were involved in the Pulse nightclub event. I know all of the surgeons that are out in Las Vegas, and I can only imagine what they're going through.
She says these mass casualty events can take a toll on a hospital's staff.
I'm sure the providers have their heads down and are taking care of patients, but will have some downstream emotional effects of taking care of so many people in such a short period of time.
And Dr. Davis says this trauma center runs disaster drills twice a year. Also along the I-95 corridor, hospitals in Bridgeport and Norwalk are Level 2 trauma centers. We're live at Yale New Haven Hospital. I'm Justin Shecker, NBC Connecticut News. Tara, back to you.
All right.